board-certified plastic surgeon practicing in Toronto. The eye area is a very common request for rejuvenation in my practice, and it makes sense because the eye is probably the main point of focus during eye contact when we talk to people. There are several ways to rejuvenate the periorbital region. One common way is to use the muscle weakening agents such as Botox and Dysport to soften the crow's feet. Another non-surgical way to rejuvenate the periorbital region is the use of fillers such as Restylane and Rejuvenate. Those fillers are commonly used in the infraorbital or the under the eye area to rejuvenate this area and to replace the volume that was lost with aging. This filler under the eye will also help the slight discoloration that we all get with aging. Another common way to rejuvenate the periorbital region is the use of PRP, platelet-rich plasma, also called cell-fill, which is basically a technique where we harvest blood from the patient. We centrifuge, divide the different components of this plasma, and re-inject the plasma with its growth factor into the area. It will have the benefits to stimulate your own stem cells and rejuvenate the periorbital area. One other non-surgical way to rejuvenate the periorbital region is laser resurfacing. Laser resurfacing is commonly used in the lower lid region when fine wrinkles and a slight excess of skin is present without excessive fat pads. There's a point in time where non-surgical procedure will no longer be sufficient to rejuvenate properly the periorbital region. In those situations, we will consider an eyelid surgery, which we refer to as blepharoplasty. Upper lid surgery can be done alone, where we remove a crescent of skin and the fat pads located in the upper lid region to rejuvenate the upper lid. The final scar will be located in the upper lid crease, which will be very hard to see once healed. This is a very good reason why upper lid surgery along with liposuction are so common procedures in the males. When we discuss lower lid surgery, there are different techniques that apply. If a patient has strictly fat pads and no excess of skin, the fat pads can be removed via a small incision inside the lid in the conjunctiva. For most other cases, patient will have an excess of skin along with the fat pads, and a subciliary incision, that is an incision just below the eyelashes, will be performed. The skin will be lifted, the fat pads will be addressed, the skin will be excised, redraped, and sewed. Now, I offer various treatments of the fat pads. In some selected cases, all fat pads are removed. In most of my cases, however, some of the fat is preserved on its pedicle and redraped over the orbital rim to replenish the lost volume that everybody gets with aging. Now, it is very common to perform 4 lids surgery together as a one procedure, and it is very important when I meet with my patient to discuss the role of suspension of the lower lid to prevent any complications. So we all agree that the eyes are very important for everybody, and the eyes are really the windows to the soul. So when seeking a procedure to rejuvenate your eyes, make sure you seek a board-certified plastic surgeon with experience in facial aesthetics.